Hey there, Dr. Vadas. Thank you very much for that very informative talk. So just going from the top here, first question is, could MCAS be triggered after a CSF leak being sealed? And could it also be responsible for a prolonged rebound, high pressure, even if MCAS was never present before the EBP?
It's a very interesting question, and thanks for that. So we see basically two types of presentations of mast cell activation syndrome. One type is sudden onset, and it's literally people describe that it's from one day to the next they become highly symptomatic, whereas they were high functioning and perfectly well before that. And then there's a more insidious type that starts from a very young age, and people will say, well, I've had it for as long as I can remember. So I guess within your question is, when I think about that, if we have somebody who's got a CSF leak and they've got EDS and we know that there's a very close correlation, I'm not sure that it's causal, but let's call it a correlation anyway, between EDS and mast cell activation syndrome, then perhaps it's the background of EDS that was responsible for, no, I shouldn't say responsible, but it was the background of EDS that made it more likely that an individual might have mast cell activation syndrome as opposed to the CSF leak itself.
Okay, thank you, Dr. Vadas. So moving on to the next question. So we have an audience member saying that she's been allergic since she was a child, but not allergic to food until up until a year ago. She's now allergic to everything, including nuts, fruits, all kinds of pollen, and asthma triggers. The question for you is, do you think these changes in her allergies could have a relation to MCAS and her leak problem? Would it make sense to get tested? She is hypermobile with a Baton score of 8 out of 9, and is currently awaiting testing for EDS. She does have a diagnosis of IBS, Hashimoto's thyroiditis, is positive ANA, and has had a tryptase test a year ago, which was normal with a result of 2.2.
Okay, thanks for that. People who have mast cell activation syndrome are symptomatic not because they have allergies, but for an altogether different reason that I didn't touch on in my talk. And the reason that, and I'm speculating, I want to make that clear because it's not in literature, but first of all, the fact that there is this really strong background of autoimmunity within the POTS population, within people with EDS. And we know as well that autoimmunity is much more common in women than it is in men. And thirdly, in somebody who has one autoimmune condition, they're much more prone to developing other autoimmune conditions. So having said that, my own bias, and this is the bias I bring as an immunologist, my own bias is that mast cell activation syndrome is also caused by autoimmunity. And I think specifically it's caused by autoantibodies that are directed against the KIT receptor that are activating antibodies. And those antibodies, when they bind to the receptor, will cause mast cells to fire off and release their chemical mediators. There is another receptor on the mast cell called the MRGPRX2 receptor, and it is possible that antibodies can be directed against that receptor as well. So all of this is to say that when somebody has symptoms of mast cell activation syndrome, then it's more likely to be endogenous or autoimmune as opposed to something from the outside world. So when you say that you've got a lot of symptoms, a lot of allergies, whether it's to tree nuts or pollens or what have you, then those are descriptions of people who have secondary causes of mast cell activation syndrome instead of the so-called idiopathic cause. Now, the two can coexist together, but I don't think that having mast cell activation syndrome will predispose to acquiring more allergies than might have existed beforehand. And I think the literature is more or less consistent with that as well.
Great. Thank you for that thorough answer. So I think we just have one last question here. What nutritional changes or supplements would be of potential benefit to someone with a CSF leak and possibly EDS? And then are there any resources or studies on the connection between nutrition and CSF leaks and/or EDS?
I really can't speak to CSF leaks. I have no expertise there whatsoever. As far as mast cell activation syndrome, there's a lot online about low histamine diets. They haven't really been validated, but there's no harm in trying low histamine diets to control those. And that's been predicated again on some unvalidated data that suggests that there's a deficiency of diamine oxidase in people who have mast cell activation syndromes. There really isn't good convincing evidence for that, but if somebody wants to try a low histamine diet, there's no downside to it. There's no toxicity, and it doesn't lead to any nutritional deficiency. So I certainly have no concerns about it.
Okay, great. Thank you very much for that, Dr. Vadas. And yeah, thank you for your time. It looks like there aren't any, no more questions. And I think we're right at time to move on to the next presentation.
Hey, thank you all very much.